A summer on the Gulf Coast should be joyful, filled with laughter, sunshine, and the soothing sound of waves crashing on the shore. But for some Louisiana families, it's turned tragic, casting a dark shadow over what should have been a season of happiness. 2 people recently died after eating raw oysters, victims of Vibrio vulnificus, a dangerous flesh-eating bacteria that lurks in warm coastal waters. This year, Louisiana has seen 22 Vibrio cases and 4 deaths, triple the usual numbers, alarming health officials and residents alike. 2 deaths were from eating contaminated oysters, 2 others from open wounds exposed to seawater, highlighting the bacteria's dual threat. These cases highlight the 2 main ways this bacteria infects people, through raw seafood and through wounds in contact with water, making it a hidden danger. The spike in cases is a warning. Environmental conditions are changing, making these infections more common and more severe. Each case is a person, a family, a community affected, leaving emotional scars that last long after the physical wounds have healed. Whether you're a local or a visitor, anyone can be at risk if they're unaware of the dangers lurking in the water and on their plates. Understanding the threat is the first step to staying safe. By being informed and cautious, we can all enjoy the beauty of Louisiana's coast without fear. Vibrio vulnificus is a naturally occurring bacterium in warm, brackish waters like the Gulf of Mexico. It thrives as water temperatures rise, making infections more common from May to October. This bacteria can cause necrotizing fasciitis, a fast-spreading, life-threatening infection. Cases are now appearing further north as oceans warm, expanding the threat beyond the Gulf. You can't see, smell, or taste Vibrio in oysters, making raw shellfish risky, especially in warm months. Oysters filter large volumes of water, concentrating bacteria to dangerous levels. That's why oysters are so often linked to these infections. Vibrio vulnificus, a dangerous and sometimes deadly bacteria, can infect people in 2 main ways: by eating raw or undercooked seafood, especially oysters, or by exposing open wounds to contaminated water. This bacteria thrives in warm, brackish coastal waters, making certain environments riskier than others, especially during the summer months when water temperatures rise. The first path is through wounds. If you have even a small cut or scrape and swim in water where Vibrio is present, the bacteria can enter your body and cause a serious infection. The second path is through eating contaminated seafood. Consuming raw oysters can lead to septicemia or blood poisoning, with symptoms like vomiting, diarrhea, abdominal pain, and dangerously low blood pressure. These symptoms can appear quickly and escalate rapidly. Even minor cuts or scrapes can let the bacteria in if you swim in warm coastal waters, so it's important to be cautious and avoid swimming with open wounds. Wound infections from Vibrio vulnificus develop quickly. Look for redness, swelling, pain, and sometimes tissue death, which can require urgent medical attention. In severe cases, the infection can spread rapidly and become life-threatening within hours. In Louisiana, recent cases show how deadly this bacteria can be. 2 deaths were linked to eating oysters, while 2 others were from wound exposure. These tragic outcomes highlight the importance of awareness and prevention. Any break in the skin, no matter how small, can be an entry point for Vibrio. Even a tiny nick or scratch should be protected and kept clean, especially if you're near the ocean. Protecting your skin is just as important as being careful about what you eat. Use waterproof bandages on cuts, and always choose seafood from reputable sources. Don't underestimate the risk from minor wounds. Clean and cover them promptly, and seek medical help if you notice signs of infection after water exposure. Staying vigilant by checking your skin, treating wounds, and making smart choices about seafood can help prevent a potentially deadly infection. Anyone can get sick, but those with weakened immune systems are at highest risk. Chronic liver disease, cancer, diabetes, HIV, and certain medications make infections more severe and deadly. Older adults and people with reduced stomach acid are also more vulnerable. The CDC urges high-risk individuals to avoid raw or undercooked shellfish entirely. People with these conditions are up to 200 times more likely to die from Vibrio infections. Know your health status and make informed choices to protect yourself. Protecting yourself and your loved ones doesn't have to be complicated. By following a few straightforward steps, you can dramatically reduce your risk of illness and keep your family safe and healthy, especially during the warmer months when risks are higher. One of the most important things you can do is avoid eating raw oysters, particularly from May to October when bacteria levels are higher. Always make sure shellfish are cooked thoroughly. Steaming or boiling until the shells open is best. This simple habit can prevent serious illness. If you have any cuts, scrapes, or sores, it's best to stay out of warm coastal waters. Even a small wound can let harmful bacteria in, so avoid swimming or wading if your skin isn't fully intact. If your wound does come into contact with salt water or raw seafood, wash it immediately with soap and clean water. Keep an eye on it for redness, swelling, or pain. These could be early signs of infection that need quick attention. Be aware of the symptoms of infection, such as fever, chills, nausea, or skin changes. If you feel sick after eating seafood or spending time in the water, don't wait. Seek medical help right away. Early treatment can make a big difference. When you visit your doctor, be sure to mention any recent seafood meals or time spent in coastal waters. This information helps your doctor diagnose and treat you quickly and effectively. Don't keep this knowledge to yourself. Share these tips with friends, family, and especially those who may be at higher risk, like older adults or people with weakened immune systems. With a little caution and the right information, you and your family can continue to enjoy Louisiana's beautiful coast and delicious seafood safely, making the most of every moment together.